Hello and welcome to another episode of TheLiverDoc. So if you have not noticed, there is a particular season where particular companies making a particular product has actually a lot of business that happens. And that season is the dengue fever season. So during dengue fever, you can actually see that a lot of company products, proprietary company products, which include papaya leaf extracts, are sold like hotcakes. A lot of people just buy papaya leaf extract capsules or make themselves at home papaya leaf extracts and take it for dengue fever to increase their platelet count. And this is rampant in India, and I think everybody just does it without even asking a doctor if this is actually helpful. And I think even a lot of doctors also prescribe it, not just Ayurveds or other traditional healers, but even modern medicine doctors do prescribe papaya leaf extract or your Ayurvedic company made papaya leaf extract capsules to increase platelet count in dengue. So does papaya leaf extract really help increase platelet count? In this episode of TheLiverDoc, we'll be talking about something interesting. We will be talking about how papaya leaf extract can actually increase platelet count in patients who have very low levels of platelets. Or does it? Let's discuss about it a bit. So when you talk about low platelet count, it is medically known as thrombocytopenia. So thrombocytes are the platelets, and when the levels go down, it is known as thrombocytopenia. And dengue fever is one of the commonest causes for acute thrombocytopenia, that is when your platelet counts reduce very fast and within a short period of time. And a lot of people actually give their experiences saying that when they have taken papaya leaf extracts or made at home, or even the capsules and tablets that are available in the market, when they consume it, their platelets have gone up. And a lot of testimonials, a lot of anecdotes, a lot of personal experience are all over the place. Even studies. So when you look at the studies that actually talk about papaya leaf extract use in patients with dengue fever and low platelet, you can actually see that some of these studies have shown positive results. That is, their platelets have actually increased because of the use of papaya leaf extracts. But are these really true? I mean, are these studies done in a very well controlled manner and properly to look at how papaya leaf extracts actually increase platelet? For that, we actually have to know the causes for low platelet count. So low platelet count can be due to infections like dengue fever or even malaria. Low platelet count can even be due to liver diseases. So if your patient has chronic liver disease or a cirrhosis, you can actually have a very low platelet count, which actually persists for a very long time, as long as the disease persists. And the reason for low platelet counts in other people may be something known as immune mediated thrombocytopenia. That is when your immune cells attack the platelets, destroy them, and your platelet counts go down. So the reasons for low platelet count is large, lot of reasons, including cancer. Some cancers can also present with low platelet count, some blood cancers, also some cancer therapy. For example, some chemotherapies that we give the patients can also lead to low platelet counts. So low platelet count reasons are multiple. So when you target the reason, your platelet count will actually increase. So for example, in immune thrombocytopenia, when you give steroids or immunosuppression, then your platelet counts will increase. So that is a treatment of choice. In liver cirrhosis, when you treat something known as portal hypertension, that is very high liver pressures due to shrinkage of the liver, then the portal pressures, when the portal hypertension goes down, the liver pressures go down, you can actually see an increase in platelet count. Or in some situations, patients with liver disease will have large spleen. The spleen is an organ that is situated on the left side of the body. So when the spleen size increases, you can actually have a reduced platelet count because the platelets are taken up by the spleen organ and destroyed in it. So when you reduce the size of the spleen through various methods, for example, there are interventional methods, there are surgical methods. When the spleen function reduces, the splenic activity reduces, your platelets will again go up. So every aspect of low platelet, you don't actually directly treat the low platelet, you actually treat the cause for low platelet. So similarly, in dengue fever, you have low platelet count. And what is the reason? it is mostly because of multiple reasons. It's not just a single reason. So for example, in dengue fever, one of the theories is that when there is an immune attack, because of the virus in the body, there is an immune attack, there is an immune problem happening inside the body, and that immune problem leads to destruction of platelets, that is immune mediated platelet destruction. You can actually have direct attack by the virus in the body that leads to bone marrow depression or suppression, that is the activity in the bone marrow. Bone marrow is where all the cells, blood cells are formed, including the platelets. So when the bone marrow gets suppressed because of the infection or the severe infection, the platelet production will decrease. Some of these patients will have severe dehydration, something known as capillary permeability, that is their small blood vessel starts leaking out fluid, and because of that you can have platelet destruction and low platelet count. So a lot of factors actually contribute to low platelet in dengue. So how do you actually treat low platelet in dengue? You actually treat the dengue fever, right? So you give best supportive care in dengue fever, and the platelet count will reduce as the infection comes down. So for this, one has to understand what is natural history of a disease. So whenever a disease actually starts, it progresses in some form and then it comes down and becomes normal, or it progresses. If there are chronic diseases, it keeps going on and you have a long natural history. For example, in chronic liver disease cirrhosis, you have a long natural history which almost goes up to the lifetime of the patient. And in dengue fever, what happens is that you will have initially severe fever, vomiting, nausea, you will have severe body aches, some of them will have a skin rash. All of this happens in the first 3 to 4 days, and during that time the fever will start coming down. So on the third and fourth day is when your platelets start dropping. And when you look at these patients, once you give supportive care and once the platelets are heavily reduced during the 4th, 5th and 6th days, by the 7th and 8th day, automatically they start rising because your infection is coming down. So this is a natural history in dengue. So the dengue fever comes up, fever goes, platelets start going down, and by the 6th and 7th day, once the infection is slowly coming down, the platelets start rising, and this automatically happens. That is what happens in dengue fever. It's a natural history. So what happens? Now if you look at the people who have been consuming papaya leaf extracts, they have been actually consuming the papaya leaf extracts once their platelet actually goes down. So when they see that on the 3rd and 4th day, their platelet levels are going down, they start taking these papaya extracts and papaya leaf pills or capsules. And they take it for the 3rd, 4th, 5th and 6th day. And on the 7th day that they'll see that their platelets are rising. So with or without the papaya leaf extract, their platelets are supposed to rise on the 7th and 8th day. This happens. Right. So it is actually a wrong, it's a bias. It's something like, it's not as a post hoc fallacy. That is because you did a particular thing and something happened, you feel that it happened because of that particular thing that you did. This is actually a wrong thing or a wrong understanding of how disease processes work. So imagine that you give papaya leaf extracts from the first day of fever, and then you see that on the 4th day or 5th day the platelets are not coming down at all. That means papaya leaf extracts are useful. Now go back and look at all the studies that has been done in papaya leaf extracts. You can in dengue fever, you can actually see that most of these studies have actually given the papaya leaf extracts and the papaya leaf capsules when the platelets were dropping. So when the platelets were dropping, they have started papaya leaf extracts, and by the time the platelets are supposed to climb up on its own normally, and the people are continuing papaya leaf extracts, they feel that it is because of the papaya leaf extract that the platelets have risen. So this is a wrong conclusion, and most of these studies have actually done that. So that is why they are of poor methods. But there are randomized control trials, a few of them that have studied papaya leaf extract use. So when you look at the latest analysis of all these randomized control trials, this is known as meta-analysis, and this is done from Sri Lanka, a group from Sri Lanka. They have looked at all the major studies done on papaya leaf extract in dengue fever, and they have found out that even though some of these studies were of fine quality, most of these studies lacked good methodology. Some of them had very low numbers of patients included. Some of them had actually given papaya leaf extracts just before the drop in platelets. Some had given the papaya leaf extracts just after the platelets had come down. So a lot of methodological problems, because of which they could not actually identify a good outcome with papaya leaf extract. But When you looked at all the studies together, they identified that papaya leaf extracts did not actually improve platelet counts the way they wanted it to. And this is a meta-analysis data that has been published in 2019. So I'll be linking all of these studies below in this video so that you can actually take a look and see the confusion in actually concluding that papaya leaf extract is actually recommended for low platelet count in dengue fever. It is not recommended. You look at any infectious diseases society in the world, Europe, US, India, anywhere you look, papaya leaf extracts does not feature in the guidelines for treatment of dengue fever. See, it's very simple. If dengue fever is such a deadly disease, it's all over the world, it's endemic in a lot of parts and it kills a lot of people. And low platelet count and bleeding and everything is one of the biggest issues with dengue fever. And if such an intervention actually really did help people increase their platelets, it would definitely feature in all the world guidelines on management of dengue fever. But if you actually look at it, it doesn't. Which means that it is not useful. Which means that all the platelet stories, high platelets becoming high stories that you actually hear on Twitter and all other social media, WhatsApp, whatever, they are all personal experiences. They don't mean a thing. Because controlled studies have actually shown no conclusive evidence that platelets can actually increase with papaya leaf extract, and a large analysis of all of these studies also did not show any conclusive evidence. So the thought or the experience that you had because of papaya leaf extract, your platelets have increased in dengue fever, is actually because they are supposed to increase, because you had a mild dengue fever or a classical dengue fever where platelets drop and it goes up. See, I myself can give you an anecdote. I had dengue fever last month and it was quite severe. I had to be hospitalized for 2 days. I had to be hydrated very badly, very, very intensively, because my platelet count went down to 20,000. And my platelet count started reducing around 4th day, and by the 6th day it was like 20,000. Suddenly from 1 lakh it went to 20,000 couple of days time. And I was just given good hydration at that time and good nutrition and nothing else. I did not take any papaya or papaya leaf extracts or papaya salad also, nothing. And by the 7th and 8th day, my platelets just shot up from 20,000 to suddenly 60,000. And by the time it was 9th and 10th day, it was above 1.5 lakhs. So this also happens without papaya leaf extract. So the wrong notion that papaya leaf extract increases platelet count is wrong. So imagine if papaya leaf actually increased platelet count in dengue fever. You have a host of a lot of other diseases where low platelet count is a big issue. For example, cancer chemotherapy, various cancers where your bone marrow actually fails because of the cancer involvement of the bone marrow, and you get really low platelet counts, and little children, they all bleed to death because of very low platelets. And also in cirrhosis patients, cirrhosis patients are for life suffering from low platelet count. But none of us give papaya leaf extracts to these patients for life. Oncology societies, cancer specialists never give papaya leaf extracts to cancer patients with low platelet count. Why? Because it doesn't help. It doesn't mean anything. So why are we only concerned about dengue fever? So that is the whole point. Because dengue fever is the place where you can actually self-fear about low platelet count. And in that frenzy, in that confusion, people just go and buy and take papaya leaf extract wherever they can get it when they get dengue fever, and they see that their platelets are dropping. This is good for the business. A lot of people buy papaya leaf extract in the form of pills and capsules sold by a lot of these pharma companies, including modern pharma companies sell it because they know, gullible people who have no idea about how dengue fever works or how dengue fever gets improved, or what is the cause of low platelet count and how low platelet count automatically improves in classical uncomplicated dengue fever. These people are the ones who actually go and consume papaya leaf extracts or buy papaya leaf extracts in the form of capsules from all these pharmacies. They are just wasting their money, giving their hard-earned money to these pharma companies or Ayurveda pharma companies. So please remember, the reason for low platelet count in dengue is multiple, and without an improvement in dengue fever, you will never have an improvement in low platelet count. And in classical or uncomplicated dengue fever, you can actually see that platelet count automatically increases as part of the disease. When the disease goes down, it automatically increases from the 6th and 7th day. And use of carica papaya leaves or papaya leaf extracts before or after the start of the low platelet count does not actually improve anything. It happens. Now look at the complicated part of dengue fever, something known as dengue hemorrhagic fever, where you have persistent low platelet and patients start bleeding. If you look at the studies in those group of patients on papaya leaf extracts, you will not see any. So very cleverly, these scientists or who's done work on papaya leaf extracts, or these companies who have done work on papaya leaf extracts in dengue fever, they have actually very nicely excluded dengue hemorrhagic fever, where there is persistence of low platelet count, and they have actually not studied those patients. So imagine if you actually give carica papaya leaves in patients with dengue hemorrhagic fever, with severe dengue, with persistent low platelet count, and if the platelet actually goes up without platelet transfusion, you don't transfuse any platelet, then we can actually say that carica papaya leaves or papaya leaf extracts are actually useful in dengue fever. But those patients are not studied. They are very willfully, intentionally ignored from studying, because they know that this leaf is not going to work at all in such patients. So the low platelet activity in dengue fever improves on its own in mild to uncomplicated cases. In severe cases, without transfusion of platelets, you will not increase the platelet count. And carica papaya has been used or is recommended by people who have very low scientific temper in analyzing the studies on carica papaya, because they don't actually have that power to critique these papers well, and they all just look at the title and just the small conclusion and say that it works. But if you actually go deep into these studies, you can actually see that most of these patients were given papaya leaf extract after the platelets have dropped, and during the normal course of the increase in platelets, they have erroneously or mistakenly told that the platelet count has increased due to carica papaya leaf extract use. And when you looked at all the studies, together, we found out that there is no conclusive evidence to show that papaya leaf extract does not work in dengue fever, and it is not recommended by any clinical society, any infectious diseases clinical society in the world for dengue fever. This is a fact. Now people will come and comment under this video about how papaya leaf extract saved them. I mean, good for you, but know that that's your personal experience and doesn't mean a thing. It has no value in the scientific method and no value even in recommending such for other patients with dengue fever. So dengue fever, you need best supportive care, and without best supportive care, it is difficult to manage this disease. And along with best supportive care, if you are going to give carica papaya, it is not because of carica papaya leaf extract that things have gotten better. It is because of the best supportive care. So please realize this fact, and know that low platelet count due to multiple causes cannot be targeted or improved by carica papaya leaf extracts. I would also like to point out the fact that there are mechanisms by which platelet counts actually increase, right? So if you give a medicine or an extract, you have to see that because of this particular action in the body, the effect is happening. So such that particular kind of mechanism of action of carica papaya leaves is still not understood. Just imagine. So if you look at a painkiller or an antibiotic, we can say that antibiotic actually kills that bacteria because it acts on the cell wall of the bacteria or inside the bacterial, inside the microbe. It destroys the DNA or it destroys some part of the bacterial organelle, and that is how the bacteria dies, because of that particular antibiotic. So we have mechanisms of action that we know of. So such a mechanism of action of increasing platelets in dengue fever because of carica papaya is not yet understood. So there are a lot of theories floating around saying that there is an enzyme called lipooxygenase enzyme which increases platelet specific lipooxygenase enzyme, which is increased with the use of carica papaya, and because of which platelets are increasing. These are all hypotheses. People have proposed this, but nobody has actually identified this in humans or in small animals or in the major tissue based studies. A lot of work on carica papaya at the molecular level happens in cells and tissues and in small animals, and the good amount of work that we see in the humans are actually of low methods and low quality, because of which we have conclusions on it. So I think in future maybe we will identify some chemical or something from the papaya leaf extract that actually can increase platelet counts. We don't know, but until then we'll have to wait, and until then please remember, papaya leaf extract, very bitter. You cannot actually take it. It's not palatable. Don't torture yourself on that. Instead, have some papaya salad, which is actually good. You can have some good papaya salad. You can have some papayas. It's a good laxative. It will relieve your constipation and things like that. So use papaya where it is actually good for use, and just leave the leaves and stems and barks and all alone, because that don't work out. And I hope this video was useful to you, and I'm going to put up all the links for you to check based on what I have been talking here. And take care, be healthy, and let science lead the way. Thank you, and until next time, goodbye.